ever wondered where the COVID-19 virus originated? Let's travel back in time to the final days of 2019, to a bustling city in China known as Wuhan. Here, the first known cases of a novel, highly infectious virus were reported. This virus, which we now know as COVID-19, was a mystery, its origins unknown and its impact unpredictable. As word of this strange illness began to spread, so too did the virus itself. From Wuhan, it journeyed across China, seeping into neighboring countries, and eventually, it traversed oceans to reach every corner of the globe. The world was gripped by confusion and fear. Health officials scrambled to understand this new threat, while governments wrestled with how to respond. Data began to paint a picture of a rapidly spreading virus, one that respected no borders and showed no mercy. And as it spread, it began to evolve, leading to the emergence of different variants. How has the COVID-19 virus evolved over time, and why does it matter? Well, since its emergence, the virus has undergone numerous mutations, resulting in different variants. Some, like Alpha, Beta, Delta, and Omicron, have grabbed headlines worldwide. Each variant represents a slight tweak in the virus's genetic makeup. The Alpha variant, first identified in the UK, showed increased transmissibility. Then came Beta, identified in South Africa, raising concerns about potential resistance to vaccines. The Delta variant, first found in India, took over as the dominant strain due to its high transmissibility and severity. And now, we grapple with Omicron, which has a large number of mutations, and its impact is still under study. These variants have spread globally, altering infection rates and disease severity. This continuous evolution shapes our fight against COVID-19, influencing everything from public health measures to vaccine development. The evolution of the virus has had a profound impact on our lives and societies. What has been the impact of COVID-19 on human life and societies? It's a question that brings a cascade of images and emotions. The pandemic has shaken the very core of our healthcare systems, revealing cracks and vulnerabilities. Hospitals have been stretched thin, and the medical workforce, our frontline warriors, have faced unprecedented stress and exhaustion. The economic sectors haven't been spared either. Businesses have shuttered, jobs have evaporated, and the global economy tumbled into a recession. The data speaks volumes, painting a stark picture of the economic devastation that has rippled across nations and industries. COVID-19 has also acted as a catalyst for societal change. Work patterns have evolved, with remote working becoming the new normal for many. Social interactions have been redefined, with social distancing measures altering how we connect and communicate. And yet, despite the turmoil, the human spirit remains resilient. As we grapple with these challenges, efforts to control and mitigate the virus are ongoing. What are the ongoing efforts to control and mitigate the impact of COVID-19? This is a question that many of us are asking. Around the globe, nations are joining hands to combat this invisible enemy. Vaccination campaigns are in full swing, aiming to reach every corner of the planet and protect as many people as possible. Public health measures such as mask wearing, social distancing, and frequent hand washing are being enforced and encouraged. International collaborations are playing a pivotal role in this fight. Nations are sharing scientific data, resources, and strategies to create a united front against the virus. But the journey hasn't been without challenges. From vaccine distribution inequities to misinformation, we've encountered obstacles that have tested our resilience. Yet every challenge brings a lesson. We've learned the power of global cooperation, the importance of science, and the necessity of preparedness. While these efforts have made a difference, the journey towards the end of the pandemic continues. How might the COVID-19 pandemic eventually end? A question we've all found ourselves pondering. The answer lies in several potential pathways. Firstly, there's herd immunity, where a large part of the population becomes immune to the virus, either through vaccination or previous infection. This limits the virus's ability to spread, protecting those who aren't immune. Secondly, we have antiviral treatments. Scientists worldwide are relentlessly working to develop effective treatments that can reduce the severity of the disease and prevent hospitalizations. And let's not forget other scientific advancements. Innovations in rapid testing, better protective equipment, and more efficient contact tracing technologies are all contributing to the fight. But no matter which pathway we follow, the importance of ongoing vigilance and preparedness cannot be overstated. We must continue to adapt, learn, and cooperate on a global scale. As we navigate this path, remember, every action counts in our collective fight against COVID-19.